Welcome to the Think Data podcast, brought to you in partnership with DataWorks. Today, I'm joined by Kinshuk Mishra. Here's the CTO at Cedar. They are a really interesting Series D health tech company who are on a mission to fix the broken healthcare payment experience for everyone. He has a really interesting background. He's worked for, well, pretty much all of them: YouTube, Spotify, Amazon, Expedia, and EA. And as kind of just joked off camera, he actually spent some time with House Party. And obviously for people who unfortunately went through COVID, it was a product that blew up, and he spent some time there. So he has a really interesting background. And I'm really keen to, I suppose, kick this off with a question everyone likes to have answered. When someone's worked for such big organizations, and I know you were an engineer by trade, you then held pretty senior leadership roles at the likes of kind of YouTube and Spotify, flagship brands out there. What drew you to Cedar? Because back then, 2.5, 3 years ago, probably earlier stage to where they are now, but what drew you to them out of kind of all the other options you may have had on the table?
Yeah. Firstly, Alex, thanks for having me on the podcast. It's great to sort of be talking to you. And to get to the specific question, right? I'm fundamentally a product builder. I enjoy working on different kinds of products at different phases of product building. Some of the companies you mentioned at Spotify, I was part of building a lot of things from scratch, 0 to 1. When I started at Spotify, it was a fairly small company actually back in 2011. And then YouTube is a different beast altogether, very mature video platform. A lot of the changes you implement are like micro changes, but they all add up at that scale at which they operate. And, working on a mature product is very different. So having experienced all of that, having built a lot of things, one of the itch I had was to actually sort of work on an enterprise product. And all along worked on very solid consumer products, and building for enterprises is a different undertaking, Yeah. In many ways, what your customer is asking for. The problem resolution can be a lot more direct. Because, you don't have to guess, you don't have to run experiments. You do, but most of the time, so customers are telling you what they need. But at the same time, right, it's a very different dynamic where in healthcare, the feedback loop is pretty long. So that was a new skill I wanted to acquire. Also, at the very end of COVID, we all saw the ways in which healthcare deliveries struggled and suffered. And It felt like a great opportunity to bring sort of a lot of the traditional technology skills in that domain. So not just me, but many other technical leaders I've seen have transitioned over to healthcare during that phase, because it felt like it's an industry which can actually benefit from technical minds which have operated in other product domains. So those were the reasons which sort of, drew me to Cedar. And in particular, why Cedar? Because I think that the culture of the company was very solid, continues to stay very solid, rooted in candor, it's rooted in being very sort of aligned to the mission. But also the people, right? At the end of the day, the leadership team we had then and we have today is very strong. They come from very different backgrounds. It's a very good mix of people who've come from healthcare backgrounds, people who've come from, traditional technology companies, but also people, who've worked in consultancies and have seen the industry shift and navigate a lot of the changes over the past few decades. So it's a good mix of people solving a very a lofty and ambitious problem. So those were the reasons that attracted me to Cedar.
Interesting. I'm keen to touch on that. I know I said at the introduction, obviously the healthcare payment space, obviously they're very mission driven, but equally the product kind of backs up the mission here. But what problem is it solving predominantly?
So at the root of it, right? One, just to sort of set the context for the macroeconomic environment. In the American healthcare industry over the past many years, there's been a rise in people losing their insurance, people being on high deductible plans. People also sometimes struggling to, get the benefits, the insurance benefits, because they have to re-enroll in Medicaid and so on every year. That puts a lot of stress on patients to sort of get the right kind of medical healthcare delivery that's necessary. And for hospital systems, their mission is to actually heal people, but these financial troubles come in the way of delivering healthcare effectively. What is required is a solution where you can offer a lot of affordability solutions to patients. You can also create very solid financial products, but also make the patients easily understand the details of their bill, the things that they owe, because in many cases, even patients, well-intentioned patients who actually do not have affordability problems, just because they weren't communicated about the invoice details, they can sometimes trash their paper statement and then be sent to collections because they completely missed out on making that payment. So Cedar comes into the picture by making the financial experience for patients through their providers be a lot more easy and seamless, where we build solutions for patient billing solutions for hospital systems. They get delivered to patients. So we are fundamentally a B2B2C company. We sell out to the hospital systems that powers their financial experience for the patients, and sort of, helps them really like collect and because they're a very low margin business. So that keeps them in a financially healthy space. And then patients, by having the convenience and ease of payment, and also a lot of affordability options being offered through financial products, they can sort of, seek the healthcare as well, help as well. So fundamentally, that's how Cedar operates in that space. If you think about the larger ecosystem, all of this is called as revenue cycle management in the healthcare ecosystem. So Cedar is a participant in that particular part of healthcare tech.
It's interesting. And obviously, I'm having this conversation here in the UK, where obviously we're blessed by a national health service. So actually, to listeners here, most of our listeners are in the US actually. But for anyone listening in the UK, obviously in the US, it's a private sector, and actually your insurances, or whether it's employer led or your own personal insurances, the sheer cost is very high. And actually from a treatment standpoint, so you're really there to make that process from managing bills and invoices and effectively debts associated with treatments less stressful effectively.
That's exactly right. Yeah. And then, also what we've done over the years now through innovation is hospitals tend to have a lot of administrative cost as well, right? Like despite actually sending a lot of very clear details, there are outstanding questions, from patients like, hey, was this aspect of my bill covered by my insurance? What does this particular cost really mean? So a lot of that, basically means that people call into the hospitals asking for clarity. So over the years, we've also invested in helping improve the efficiency of organizations by building AI solutions right now, which can augment the call center operations and reduce the administrative burden. So while on one end, we are enabling ease in collection of revenue, both for the patients and providers, we're also trying to get into reducing the administrative burdens for the providers, the hospital systems, so that they can focus more on actually delivery of healthcare versus trying to manage all these additional costs.
Yeah, it's smart, isn't it? Because obviously there's such a staffing issue and staffing shortage in the US where it comes to healthcare. And you're right. I think the amount of time that hospital administrators, everyone in the billing department, but equally even care staff who have to sign off on invoices and approvals, then you can remove that burden and actually allow them to provide better care and focus on their additional elements of their day job. Then obviously it's win-win for everyone. And you touched on something there about the AI component. And obviously as a kind of a podcast that focuses heavily on AI. And I think you mentioned at your introduction, you joined at a really interesting inflection point post-COVID. AI was obviously technology was really growing quickly. But how important is AI technologies within the solution at Cedar? Because I'm assuming it forms part of the solutions. I'm keen to dig on that if you can.
Absolutely. So even before the generative AI became such a sort of common buzzword, traditional AI, which entail sort of machine learning techniques, have been heavily used and incorporated in our workflows for a very long time. Cedar has had traditional ML based solutions for personalizing the communication, for offering certain kinds of discounts to certain cohorts of users depending on the provider criteria. All of that had been in play for a while, but then generative AI was game changer, specifically when it comes to certain kind of capabilities which traditional ML, would not necessarily provide. When the ChatGPT moment happened, we saw a lot of inbound interest from healthcare execs asking for ways in which they could leverage this to improve their workflows, to improve their efficiency, reduce their administrative cost. And what we systematically did was try and analyze what are the key areas where Cedar is really strong? What are the key areas where we can actually deliver value? Because there's this whole universe of things we could be doing, but we won't be the best players out there to solve that problem. Where we honed in was exactly the problem, because historically we've heard healthcare administration struggles with like cost maintenance. There's a lot of cost in to collect the revenue. There's a lot of cost to run the administration. So there are several things we do, right? We try and optimize how we do communication so we can reduce the paper statement volume because that's a huge cost. Digital communication is much easier and cheaper.
Yeah.
Sometimes you're legally required and it's necessary to also deliver paper statements. But we can apply techniques to sort of optimize that. But fundamentally, when Gen AI came about, we found like the biggest opportunity was in call center augmentation automation, where we analyzed like a lot of the inbound calls and both the volumes of the calls and the types of the calls can range in variety of like inquiries, right? Like all the way from like, what does this specific line item mean in my bill to does insurance cover this aspect of my bill, all the way to can I seek assistance, right? Now, along that spectrum of different inquiries, there are some very basic inquiries where like leveraging generative AI with the right sort of techniques, with the access to the right data sets, you can really automate that and make that work seamlessly. The advantage of that is that it offers convenience to patients as well, right? Like you start getting 24/7 support, which traditionally you don't get offered by call centers.
Yeah.
You also start getting faster resolution. You don't have to wait in line for someone to show up in that call, a human agent to show up. And then some of these resolutions can be delivered in sometimes more empathetic ways as well, if you've trained your generative AI agent to be empathetic. On the provider side, the benefit is that obviously, by automating a lot more of these kind of simpler queries and escalating the more complex queries to a human agent, they can also like manage their costs a lot more effectively. The average handle time for a call goes down. Typically today it varies from anywhere from 80 minutes on an average, and we can reduce it by 20 to 30% very easily. Like this year, our goal is to actually reduce it by 30%. Next year, we plan to automate it all the way up to like 70% based on the analysis we've done. And that's huge, right? Like, so we are actually right now live. We are the first AI-powered like patient billing solution, as a voice agent, and it's not like a traditional voice bot or an interactive voice recording or responder like the IVR tree. It's very sort of agentic, which is financially fluent, understands like the details of the patient bill, and can respond to the patient inquiries directly. So that's the product we've invested in. And the early signals are very promising. Like we're actually seeing like patient inquiries getting resolved in a completely automated manner, which, would have been completely unimaginable like even 2 years ago.
Yeah, it's fascinating. I like the way you've cornered kind of both sides of the problem here. Obviously, the customer, obviously the patient, and obviously the provider side as well. And I know you touched on something there, obviously, where the engagement with the patients, you're seeing these queries resolved far quicker, obviously, in light of the new solutions. But one thing we've seen and one thing we've heard of is there's still a lot of nervousness and anticipation around technology, or let's say AI, handling personal information. So, I don't know what models you're running, but if you look at financial information or even kind of patient data, a lot of patients are still quite nervous around not being able to just physically speak to someone. If it was my nan, for example, she'd want to pick up the phone and call someone. What steps are you taking, whether it's in line with in conjunction with the provider, or just direct yourself through your own marketing? What steps are you taking to kind of educate your patient community on the solution and why it's okay and is safe?
Absolutely. So let's start by sort of, firstly, like the solution we've built, it's HIPAA compliant. It's, and we as a company sort of SOC 2 compliant, HITRUST compliant. So like we have to go through those compliance procedures. But even from a security perspective, we manage the authentication of these workflows very well. Like, people who can access these systems is well controlled. The data that we use, we strip out all the personal health information that's being used in sort of, skilling the voice agent. We never train the large language models behind the scenes using any of the patient data, right? So all of our large language models are using in the, for your technical audiences, what is called as RAG. So we retrieve a lot of the personalized information to just compose a response. But a lot of the training is done by using the right kind of prompts and by understanding these behaviors, which we've analyzed by redacting personal health information. So all these practices make sure that there's never data leakage. None of the stuff is getting trained into the large language model, so it would not reveal it elsewhere. And then the kind of prompts we have are very specific. So if there's a specific skill match, then we have that be automated. But, if we feel like the inquiry cannot be sort of responded to by a voice agent, we'll escalate it to human. So all of these things go into building confidence and trust with our buyers, the providers, right? Like they do their own AI reviews. They try and understand their architecture. We respond back by, responding to their inquiries, but also concerns they might have. So that's like the ecosystem of who our buyer is. When it comes to agents, obviously, as you mentioned, sometimes there can be hesitation that, just connect me to a real agent. In those cases, like my consumer building skills come in handy. Like what we've done is, obviously, you should always have an escape hatch. You don't want to make a user feel trapped in this conversation with this agent. There's always that escalation path to a human. None of this is in absence of a human agent. There's always an escalation path to a human agent. The second thing is you have to show and demonstrate the benefits of this voice agent to patients, because obviously there's this urge. But sometimes, if you have to wait in line for minutes or multiple minutes, you lose that convenience for a very simple question or ask you might have. Sometimes you don't know how to engage with an agent because it does not offer you the kinds of solutions. So by advertising, like these are the things we can help resolve in an automated way, people are like, yeah, that's the exact thing I was looking for. So then, they get to that really quickly. And if none of that results in any kind of resolution, they can still talk to a human agent. In the worst case, they've already been authenticated. So a lot of that context is passed along to a human agent. So at least you don't have to re-authenticate yourself. So the time is still saved. So you have to go use case by use case, truly understand what are the kinds of patient inquiries and always provide that convenience. In absence of that convenience, what happens is there's this urge to talk to a human agent. By perfecting those things, we've gotten a lot more trust from the patients, and we've actually seen the engagement rate from the patients to this voice agent go up over a period of time.
Yeah, it's interesting. In your opinion, I know I won't hold you to this, but do you think we'll ever get to a point where we'll be 100% driven with AI agents, or you'll be interacting with an AI? Do you think we'll ever get to that point, or do you think there'll always be a need for some form of human contact, or as you said, the escape hatch to a human?
Yeah. I mean, it's a philosophical question, and I don't know if I'm best positioned to answer that, because who knows how things play out in the future.
Yeah.
What I can tell you from a factual perspective is any workflow that you're trying to automate is composed of several tasks. The potential for complete workflow automation depends on the potential for each of the tasks in that workflow being automated, right? So it kind of varies across different use cases. In the workflows that we've seen, and especially in the workflow where we are, right? Like we are trying to provide as much factual information and resolution of those inquiries. To the extent we can do that by pure sort of retrieval of data, it's fine. When it starts getting a lot more complex, you can have very, very hard, like somebody's on a payment plan and then they want to access their HSA balance, but the payment plan has been partially paid. Now that might be a use case that we might have not captured perhaps, in the agent. So there will always be an escalation path, and the agent will have to keep learning it, and we'll have to keep skilling it over a period of time. So we can keep getting closer to full automation. Whether we get to full automation or not is, up for debate. But the path to that kind of workflow automation will happen in steps. And it will require a human to sort of train that agent along the way, right? Like that kind of self-learning is not going to be unsupervised. It'll have to be fairly supervised. But things might be very different for other domains, right? Like I can talk very confidently about the systems and the domain we are operating in. I think in that domain particularly, we see headroom for easy 70% workflow automation within the next 18 months. Beyond that, only time will tell us. I don't quite think we'll get to complete human replacement anytime soon.
Yeah, no, fair enough. And I'm keen to talk about Kora. It's a product you've recently launched. And can you explain kind of in layman's terms what that product is and how that ties into that kind of patient experience?
So yeah, the voice agent I was referring to is Kora.
Okay, brilliant. That is Kora.
Yeah, it is Kora. Basically, what it does is that whenever a patient has, so we've launched this with Apollo MD, which is a leading sort of staffing provider with 1,800 clinicians across the United States. So, and this pilot has been on for, I have to say, almost 2 months now. what happens is if somebody has an inquiry about a bill they received from Apollo MD, they'll call in this particular number. We are using Twilio's service called Conversational Relay, which basically sort of when somebody calls in, they route that call to our voice agent. Twilio does the work of like speech to text and text to speech translation. Once we get that particular sort of speech encoded as text on our side, then our agent can sort of process it. It does several tasks of like, authenticating a user, triaging what kind of inquiry they have, matching it, categorizing it to particular kind of intent or a skill, and then sort of, running the right kind of workflows to resolve that particular inquiry. That's based on, our understanding of their invoice, our understanding of their particular situation. If we don't have a particular skill for which, their intent matches, then we escalate it to a human, so then we sort of forward that to a human agent to navigate that inquiry. And behind the scenes, like for using, for generating conversational responses, we're using traditional, like a commodity, a large language model. We are using currently like Google's Gemini models, and we also like kind of, in different contexts have used OpenAI's models for certain things, but fundamentally, our stack is focused on that sort of authentication, triage, skill building. And then we use commodity stuff like Twilio's Conversational Relay for speech to text, text to speech. We can also tune and tweak the voice to be more human-like, less robotic. It can deal with interruptions and sort of, provide us the right context. But the hard part of actually navigating the workflows and sort of engaging with the patient when there are interruptions, getting the right kind of data, processing it, authenticating it, all of that is very, very sort of domain specific. So that's where we excel and we sort of, do the heavy lifting.
Yeah, it's fascinating. I think it's really interesting. I think the kind of, as you say, you can tweak the voice and make sure that, the interjections and actually so it sounds more conversational. And I know you're at a kind of weird inflection point, aren't you? Because you've got artificial intelligence is progressing at such a rate where organizations, and I refer to obviously in your world, obviously the provider groups, health systems, a lot of them are quite slow to adapt. They're technologically a bit averse or a bit reluctant, especially on the frontline care side. I think we're a little bit away from AI helping there, but I think what you're solving is the workflow side, the automations, the bottlenecks. How do you ensure the two kind of work together? And what I mean by that is AI is progressing at such a rate, but all the healthcare systems, rules, as you said, the HIPAAs, all the regulations saying otherwise. So how do you ensure the two kind of work in sync?
Absolutely. And that's the hard part of the job, right? Like in a highly regulated, risk-averse environment, and a lot of those things are justified, by the way. Like healthcare should be regulated. It should be
100%.
Because you don't want wrong kinds of mistakes being made there. But like as a technologist, how do you sort of keep up the pace of innovation while you're kind of being constrained in many ways for like doing that? So few things, right? Like when it specifically comes to Kora, right? Like what we've done is we've invested in the right eval systems to even just understand like the benefit of the product, right? Like the more trust you build in the capabilities of a product, the faster the adoption ends up being on the provider side. So assuming like you've done all the table stakes work for being compliant and doing all the protections for like security and maintaining privacy, which is necessary, purely adoption can still be a challenge if you're not getting the right results. So by building an eval systems, we do several things, right? Like we have LLM as a judge, which judges the quality of the responses. And then we sample a bunch of those responses and also have a human evaluator see whether there's enough amount of accuracy in the responses. So we have a metric called as a groundedness, which helps us understand, is this response grounded or was this completely hallucinated response, right? Ideally, you want almost zero hallucinations and even for complex queries, maybe minimize the amount of hallucination. So you have to tweak your LLM sort of controls, to make sure there's minimal to no hallucination. Then you should have the right guardrails, through a human escalation path. Secondly, we also measure things like sentiment of the response, right? The hope is that, you can have a grumpy human because they're having a bad day and respond back in a non-helpful way. But LLMs, they're at the end of the day still software. So they should be able to generate empathetic responses. They should be helpful. So you can measure those things again using LLM as a judge. So we just have eval systems which do that. And we want to measure we are not drifting away from those groundedness and sentiments over a longer period of time. And then if you start showing improvement in the metrics that matter, like reduction in average handle time for calls, that's true sort of savings for the providers, right? So that's the business outcome, the product outcome that we care for. So by reporting back on these things, by minimizing these errors, over a period of time, you start building trust.
Yeah.
I think like by sort of demonstrating results is how you get faster adoption. And naturally, like, this is not unique to healthcare, but more relevant in healthcare is once you demonstrate like success with your early pilot partners, there's a lot more interest because there's validation of that product because, there's, again, as you said, AI is advancing at a fast pace. There's a lot of hype. There's a lot of reality in how quickly things are progressing. But when you demonstrate real results and show the performance, then there's a lot more trust, and this becomes like a flywheel, right? Once you start showing success with a partner, then, the word spreads and others want to sort of sign up for this as well.
Yeah, it's perpetual motion, isn't it? Once they start to see the value you're bringing and how you're bringing it, then obviously they start to ask you. And as a true partner, I think as a true technology partner, they start to ask you about new initiatives. I think you mentioned when obviously ChatGPT was kind of released, you started to get a lot of inquiries around how healthcare execs could incorporate that. And I think that's very, very clear now that companies want to adopt this, but it's how. What's next for you guys? I know obviously you've experienced rapid growth. You've obviously, I've been hiring a lot, you're growing a lot, but from a tool and feature standpoint, obviously what you can say publicly, what can we expect to see from you guys over the next kind of 12 or so months?
Absolutely. So one, we are committed to sort of continuing to invest in AI. We are doing a lot of hiring for people who've had real world experience working with AI and are sort of, quick learners, because at the end of the day, right, like the technology is still relatively new and it's evolving every week. So people who are quick learners and learn coming with experience is definitely helpful. With that, one of the key things that Cedar is really good at is focus. So as I mentioned, right, like we could have done a whole universe of things when ChatGPT came to solve a variety of problems. Our focus still continues to be Kora. As I said, like end of this year, we're planning to get to like 30 to 35% reduction in average handle time through automation. We want to actually continue to push the bar and get it to 70% automation of a lot of these calls. By staying focused on that, we, as I said, demonstrate performance and results. So all the use cases, all the tasks in that whole workflow will continue to get automated. But at the end of the day, that is still one piece of the puzzle. And there's so much that can happen upstream in our application itself, where fundamentally, if people call fewer because of product itself, in the product is generatively resolving a lot of the inbound inquiries in smart ways, then people will have to pick up the call fewer number of times. So there are a lot of, without getting into the specifics, because these are some cool innovation ideas and we're still testing them out. We can do a lot of upstream product enhancements, which will reduce the number of calls. So fewer calls and all those calls being automated, net provides a lot of benefit to the providers and to the patients as well, because convenience for patients, providers can manage their costs more effectively. Outside of this, generally, like I think like most companies, we've adopted so many tools to make our own workforce be a lot more productive by using these. Again, across the spectrum, some tools are a lot more effective. Some are getting close to 20-25% tasks automated or at least easier. But some are still, giving 10 to 15% like productivity benefits. By incorporating these tools, I think our workforce has become a lot more conversant with using AI technology by prompting it the right way, by understanding, because at the end of the day, you still need architecture skills to sort of construct things together. The science that everybody's learning or the art everybody's learning is how to prompt it, how to basically translate your instructions in an algorithmic way, where the response from an LLM is a lot more effective. So I think that is starting to happen, which means I'm seeing a lot more innovation happen from the ground up as well. And there's so many cool ideas that, people are coming up with, like, can we start doing automated code reviews where basically before we submit a code review for some other engineer to review, there will be some LLM kind of a response to that. And then that can help them incorporate the feedback into their final code review request before sending it to one of their coworkers, and a bunch of other things where we can start doing some smart mapping of the data fields that we do during ingestion of different data fields from health record systems and so on. So there's a lot that's happening, which is across the board. And from a product perspective, the focus continues to be Kora and everything upstream from Kora, where we can do a variety of things to just, make the experience a lot more convenient for patients.
Sounds like you got your hands full. It's fascinating. I think you're actually probably the only one who's actually, of all the guests I've had, actually is really articulated so clearly, and for everyone listening here, the benefits that AI is bringing to internal engineering teams. And my understanding is this will just enable you to ship products and features quicker. It will free your engineers, on your point, to come to you more regularly and say, I've got this idea, because actually the automations, even as 15 to 25% cost saving, they can effectively put that into a new initiative. So do you think this is, I always get asked this question as a recruiter, is AI going to replace us? But from what you're saying, it's actually here to really complement, from an engineering standpoint, complement and improve those processes. Is that fair to say, do you think?
That's my belief. I think who knows what the future holds, and 5-10 years from now, we all might look like fools saying that AI won't replace us. Maybe it might, but at least in the near future, again, factually speaking, it's mostly amplifying everyone's workflows.
Yeah,
it's augmenting, them in ways in which, for instance, a thing that would have taken certain amount of hours, in the past for some kind of research on certain things. You can prompt and type it in any of the chat apps, LLM backed chat apps, Gemini, ChatGPT, Cloud, whatever, and get instant response rather than trying to Google through things, right? It's basically enabling you to condense certain kinds of tasks in a lot shorter times. So for an engineer today, right, like when they're trying to research how to do certain things, they can do that a lot faster. They still have to be a good engineer to understand the architecture of the system, understand the pitfalls of what's being suggested, because sometimes when you prompt, your code, you can get into these cycles of like going 2 steps forward, 1 step back, and like it's not always making the progress that you hope. Certainly, as you start getting to more complex tasks, but for a lot of this very specific, simpler tasks, it actually is freeing up your time and giving you a lot more capacity to do, as you said, focus on things which are a lot more innovative and high leverage, right? So at least the way I see things in the near to sort of medium term, it is playing an amplification role. It's made a lot of us, including myself, a lot more productive. Whether it replaces a human or not, that's for time to tell. I cannot predict that.
Who knows? Yeah, well, look, I really enjoyed the conversation. I think it's fascinating, the journey you've been on personally, but equally with Cedar and the product they brought, obviously Kora. And as you said, the uptake and the engagement levels are increasing daily. So that's you're obviously doing something right. And the fact you're solving that, the B2B and the B2C side simultaneously, says a lot for your success. Now, thanks, Kinshuk. It's been really good to have you on this morning. Thanks again.
Thanks for having me.
Thank you.